Digital healthcare and telemedicine became essential, critical, and a lifeline since the outbreak of the coronavirus. 2 years into the pandemic and in the run up to Union Budget on 1st of February, we at ET Now wanted to know how the Union Budget can actually give a booster shot to this critical space. Joining me to talk about that is Satish Kannan, the co-founder and CEO of MediBuddy. MediBuddy is, think of it as a one-stop digital destination for all your healthcare needs. Thank you so much for joining us here on the channel. Always a pleasure talking to you. So, Mr. Kannan, let's begin with what is your budget wish list on behalf of the entire space from the Finance Minister?
Thank you for inviting us. Our key asks would be, we need to increase the expenditure on healthcare. We know that a lot of other countries spend significant part of their GDP on healthcare. We need to significantly move that, which will at least be in the range of 2.5 and above. Key is to invest in primary, secondary, and tertiary infrastructure, essentially more hospitals, bring more doctors so that we are able to have larger number of medical colleges and larger number of seats allotted to them. Specific request would be, let's think about health insurance. Even today, the amount of health insurance falls under the highest GST bracket. We want more and more people to get health insurance. So we need to ideally look at changing the GST structure or GST bracket for health insurance and making it more affordable so that everybody can buy health insurance. And the last request might be preventive healthcare. And today, around 5,000 rupees is added as part of ATD because we want people to do more preventive healthcare and identify health issues earlier. It will be good if we can increase the bracket of ATD from 5,000 rupees for a family, which should be much, much larger. This might be some of the key asks that I think of.
Okay, so these are the requests from the industry, from beginning from extreme increased expenditure to just having more doctors and healthcare workers to make it more affordable. So let's go into all of this by looking at MediBuddy. So Mr. Kannan, if I could, ask you one pointed question, which is that you must have obviously seen a lot of tailwinds thanks to the pandemic, thanks to the lockdown. Going forward, will this still be the way that Indians access healthcare? Or do you think that they'll just want to go back to the old system of at least going back to their GP's clinic?
Definitely. So when we think about customers, whenever customers identify an easier, a faster, and an affordable way to access any services, they continue to stick to that. This happened in banking. It happened in booking of, let's say, movie tickets, but it's happened during pandemic in education as well as healthcare in a very, very big way. So customers across the country are able to access high quality services very easily through digital platforms. And this is here to stay. Now, COVID has given a boost in the adoption of these technologies on all three sides. One is customer or patient, another is doctors, another is regulation. So what I strongly believe is the changes that has happened for good, and it has been reinforced 3 times now. Wave 1, wave 2, and wave 3. So it has become a fabric and natural behavior, and a lot more people would access doctors very easily through video call. And based on the complexity, they would go to physical visit. So I'm not saying physical visits will entirely go away, but it's going to be a hybrid, I will call it phygital approach. Pharmacies would come home, diagnostic tests like blood test will be done at home. Only when you need to do physical examination or getting admissions, you would go to a hospital. So that's the power that has been done using digital healthcare. And this is going to be the way forward in the coming years.
So can I also ask you this one question, Mr. Kannan, because it has been talked a lot about health tech, right? And when we look at digital platforms, it's the access to healthcare. We do have higher concentration, obviously, of the doctors, the healthcare workers, and the facilities in the urban centers. So when you look at your own clientele on MediBuddy, what kind of geographies are they from?
Very, very, very important question, and very true also. Today, we help more than 35,000 patients on a daily basis, and they access doctors, pharmacies, diagnostics through our platform. And 50% of them, around half of them, actually come from very, very small towns. And the rest of the half come from big cities. So the top cities, which is around 15 cities, would contribute half of it. And the rest of them come from very, very small town for whom access to good healthcare has always been a challenge. And that's one of the vision with which we started MediBuddy. And we are very happy that during this pandemic, we have been able to help people in the big cities, but more importantly, people across the country.
Going forward, can you tell us a little bit, as the Omicron wave looks like it's going to be behind us, we've learned how to live with it, it's not as bad as one had initially thought, what your future plans are?
No, absolutely. So the idea is to ensure that customers get access to all services on a single platform. So now you can do a video call with a doctor, get the right advice. If you would like to meet the doctor in person, you can do that. We run our own clinics. We have grown our pharmacy base as well as diagnostics. So we can actually have people come to your house and pick up the relevant blood samples or RT-PCR samples. And all the way till if you get admitted in a hospital, we will help you get the insurance as well as coverage for all of them. So from a customer point of view, what has also happened is mental health has become an important area of focus, and we are significantly growing that area also to provide access to good quality psychologists and ensure that we have looking at not just therapeutic. That means you have a health issue, you start thinking about healthcare, but you think a lot about preventive. That means you take care of your food, you take care of your sleep, and you take care of your exercise, and that is preventive healthcare, and a lot of other solutions that will help you to keep in good shape. So all of these are sort of a work in progress for the coming years, and we are sort of trying to ensure that we continue to help more than a lakh patients on a daily basis, and that is exactly what MediBuddy is working towards.
Okay, that's the target. 1 lakh patients every single day via the MediBuddy health tech platform. With that, Mr. Kannan, wish you and the team all the very best. Many thanks for joining us today on ET Now.
Thank you. Thank you for inviting us.